It's a fairly wild place. It's untamed. It's a place where the paths, the rules are not so hard. You can stray off the path to the right or left and find your own space. A mutual friend of ours called me up saying that this family had come to Nepal looking for a memorial project. The family had lost their son and they wanted to look at your hospital. And so on a Monday morning, they pulled up in their van outside Patan Hospital. That particular day, I think there were 6 or 8 women who were getting ready to deliver, who were on stretchers in the hallway outside of the maternity ward. At the end of the visit, when Jim, I remember saying, "What do you need?" And I said, "Well, you saw the maternity ward. That's the next thing that we're really thinking about expanding."
We had to use one bed to examine multiple patients. The new maternity wing added 160 beds, including a new pediatric intensive care. We also had a separate set of operation theaters. It improved the quality of the services we offered. I think it gave every woman a bed to lie down in, recuperate in a more pleasant environment. You could see the doctors much happier because a lot of time we're stressed not only because of the medical problem of the patient, but with the other problems like where should we keep this patient and where can we find a bed for this lady. And so it relieved a lot of that. And when that is relieved, then we can concentrate more on the medical aspect and we are less stressed by other administrative issues. When you have a happy doctor, they are also able to give a service that is happier, I think, and spend more time on looking after the patient, counseling the patient, and actually looking towards the patient's medical needs. The arrival of every new baby, I see a new life as a new person, as a new sign of hope in humanity.
Nepal is really 2 countries, and the 2 countries are Kathmandu and then the rest of the country. The difference between Kathmandu and New York is less than the difference between Kathmandu and rural areas of the country. Wait till you get to a rural hospital. Wait till you get to a place where for a lot of the year there won't be a doctor in the hospital, where the x-ray machine is broken and there's no one to repair it, where the hospital is not in any good relationship with the community, so the staff are afraid that if they do anything wrong, the community may attack them. It is really an epic experience for somebody to get sick in the mountains and then come all the way into Kathmandu. At the core, I think, of the Nick Simons Institute, which is that people would be able to find that care closer to their village and not have to come into Kathmandu to have a C-section, or even a simple thing like an abscess on the leg or a broken arm.
At the Nick Simons Institute, our focus is on 3 areas. One is we train the government health workers in creating more skills. We train these health workers for 1 year. After this training, they are capable of giving anesthesia. And in most of these places, they are the sole provider of anesthesia. So without anesthesia, you cannot do surgery. One program that we also have is a biomedical equipment training program, where we train high school graduates for 1.5 years. So they are taught into basic preventive maintenance program and repairs. They can repair the basic machines that are there in the hospitals with a little bit of cost. I think they can make that instrument functional. Second, we have what we call a district hospital support program, where we support the rural hospitals by adding 5 core staffs and getting equipments that they need. Our goal was that they would be the only specialized doctor there, and they would be able to perform the basic life-supporting services.
I think NSI has accomplished a lot, like making changes at the government level. NSI has managed, encouraged, and supported a doctor to go and live out in the community and serve in the community.
NSI was set up to do health training for mid-level positions and train the people, when possible, outside in their own communities. One thing we did in Nepal was get general practitioners, GP, paid much more. When we adopt, so to speak, one of these district hospitals, we make sure that there's a GP there. We also typically make sure that there's a biomedical engineer there who can fix their equipment, and often an anesthesia assistant there, so the GP can do operations.
What enables a hospital to take care of people locally is trained and compassionate healthcare workers.
These are examples where, with a little bit of intervention, with a little bit of good care, we could save a life, save a limb, or save deformities, and even deaths due to medical emergency. And third is advocacy. That's when we feel that the programs that we do is taken up by the government.
The work that the NSI does in Nepal is together with the government of Nepal. We really have made a concerted effort to support and amplify and really enhance the government's efforts. That's an important goal for us.
What has left me with a very deep impression is the sincerity with which we have not only identified creating an institution and linking with remote parts of the country, providing additional resources, expertise. We have created an institution of excellence.
Nepal needs an Examines Institute for a long, long time. I think we still have a long way to go to give quality and affordable healthcare to the people of Nepal.
I think it's really fantastic how they've turned that all around and helped so many other people, so many other sons and so many other daughters. I hope this work that Jim and Marilyn's have started would go on in the same compassionate, caring and loving way they've started it.